I'm Timothy Catchings. I'm a physician who practices at Satilla Memorial Health. I practice interventional cardiology. I'm director of the Heart Center and chief of cardiology, but I'm also chief medical officer for the hospital. My medical school was at Emory University, but I graduated and had an interest in internal medicine. I did my residencies at the Medical College of Georgia, but I completed my residencies at the Naval Hospital, Portsmouth, Virginia. Afterwards, I did a fellowship in cardiology and I did critical care at Bowman Gray University in Wake Forest. I practiced cardiology and critical care for several years, but I went back in the Navy at Desert Naval Hospital and I did a cardiology fellowship. I went to the University of Missouri, did further training in interventional cardiology. I stayed on the faculty there for many years and I became an interventional cardiologist. After I practiced a short time in Virginia, I came to Georgia, my original home, to start an interventional program here in Waycross, Georgia. I like to think of myself as a glorified plumber because if your artery is clogged, particularly if it's a clogged or blocked artery that's feeding the heart, my job is to restore flow and make sure it stays open. I prevent heart attacks, treat heart attacks, and hopefully relieve people's chest pain if they have this discomfort called angina. I also work on the arteries that feed the legs and feed the arms when there's a blockage there also. Besides being a plumber, I dabble in electricity, but not too much of it. We do offer pacemaker therapy. We put in devices called defibrillators, devices that can actually shock the patient's heart internally if it goes haywire. I was an educator for many years. When I was at the University of Missouri, I actually was a professor of medicine, an associate professor of medicine. So I taught students and other doctors to be doctors. So I enjoy teaching. I like my patients to also be potential pupils because they need to be educated not only about the procedure they will have, but also about their condition, what caused it, how it can be treated, how it can be managed, and hopefully have further complications prevented. So teaching is a big part of what I do. But I also care about outcomes. I have pride in the work that I do, and I want the patients to know it. So patients have to believe that they get good care, they have to believe that they will get informed about what happens to them, and they have to know they have a caring, compassionate physician on the other end of the table.